Hello, and welcome to CivilNet. Joining me today is Professor Berj Apkarian, the Honorary Consul of the Republic of Armenia in Fresno, and a healthcare executive who has supported medical missions in Armenia for over a decade. He's here leading the 15th mission in Armenia, which includes a large-scale international medical conference. Thank you for joining us today.
Pleasure is all mine.
So the 15th mission includes three main components. There's the conference, surgical care, and rehabilitation. But this year also included an educational component, from what I understood. So why is it important to also include education along with the conference?
I think the educational component creates an important foundation to provide up-to-date information and provide hands-on training to the local clinical side of the equation as well as the administrative side. But more importantly, it's to prepare and connect, make a connection between the US prepared medical team and the local team and create a lifelong relationship in terms of friendship, but also on a professional side for them to consult with each other, address current challenges, and have a resource for the local doctors so they know they have friends they can lean on in terms of future challenges that they might face. But this year also, for the first time, we are providing nursing education, nursing making that a profession rather than just a regular component, but also introducing advanced practice, which means nurse practitioners and physician assistants, which does not exist here, and it's a common workforce that in the United States the healthcare system relies on. So it was received very well from the nursing attendees as well as from the Nursing Association as well. So we will be pursuing that endeavor as well along the side with the three other components.
The conference covered topics like disaster response all the way to AI and the use of AI in medicine. Where does the Armenian medical landscape stand in terms of these issues specifically? And is it far behind or is it where it needs to be?
Well, I'm very pleased to inform you that yes, within the 15 medical missions that we have organized, this one was a truly highest caliber in terms of the presenters themselves, from Cleveland Clinic to University of California Irvine to UCSF to Seattle, Washington University and Seattle Children's. It was, and including from Israel as well, a plastic and burn surgeon who was here back in 2023 when the explosion took place. And he came back to share his experience where the ideal environment should look like and what he experienced in 2023 and provided additional information. So the conference itself was so critical in terms of addressing important topics. And there was a connectivity. So those topics, when we were preparing for them, it was done with consultation with the Dean's office, the Rector's office, and I'm grateful to Dr. Muradyan, who's been a dear friend and very supportive, Dr. Gevorg Tamamian and others. So the locals are prepared. We do not want to say there is a class difference. It's the matter of keeping them up to date, and more importantly, the connectivity. The networking piece was extremely positive. The local surgeons and local burn plastic physicians, they all got engaged, and my heart is filled with gratification of making that happen.
And the rehabilitation team, I mean, it's not the first year that they're working, but they work in regions like Gyumri and Armavir. Would you say that it's easier working in the regions compared to Yerevan, or the opposite? Is it more difficult?
No. Talking about the rehabilitation team, we initiated the rehabilitation team at a larger scale right after the war because we saw the need and we wanted to provide be the helping hand to provide the support that they needed. At one point in time, in 2021, I had 1920 rehabilitation team members. And by the way, those are all doctor-prepared individuals, professionals. So this year the team was smaller because we wanted to re-gauge in terms of what is the actual need. They had a great experience both in Armavir and Gyumri, and it was very easy to work with them. And the local administrative team, they deserve tremendous thanks from me and the team as well. So the other night every night we do recap. What went right, what went wrong, and how can we make it better. I'm pleased to let you know that next year the team will be bigger and much more tuned in because this year they assessed, and so we're going to come more prepared. It starts anything else in life. You always do something, learn from your mistakes or learn from the success, and you try to make it better. That's our motto. That's what we are trying to do.
And you mentioned that this year, the first time, the conference is highlighting the role of nursing practitioners. Why is developing nursing profession so crucial to the medical industry?
Well, nurses are the most essential workforce in the healthcare system. Doctors come and go, they see the patient for a few minutes, they assess the medications, and they give a directive in terms of what the level of care that needs to be done. Who carries that order? The nurses. Nurses are the backbone of a healthcare system in the United States, and I believe it's over here too, and around the world. So for me, being a healthcare executive for over 37 years, recognizing that need itself, and in consultation with the local forces. So it was not that I know better. Absolutely not. We respond to the local needs and we tailor everything that we're going to do and organize the mission according to their needs, because that's what it's needed to be done. And that's the important part of the equation. Dialogue, communication, understanding, and do the right thing. So last year when we were here visiting with Dr. Arab Abloyan at Arab Care, he really emphasized that there's a lack of nursing assessment and understanding on the practical side of the equation. So as upon my return, did some assessment, and I'm very fortunate that we were able to bring with us one of the family nurse practitioner from Fresno, California, and her name is Brian Jacobson. So she came alongside to present at the conference as well as do educational sessions. Right now as we speak, she's in the outlying area with Dr. Berj Apkarian, who is from UCLA. So they are assessing what the outlying area's nursing competency looks like, and they are going to try to develop some sort of educational plan based on the needs. And as we return next year, we will make it even better. And the advanced nursing, along the side with nursing, is going to be an important endeavor to push that agenda forward.
And looking ahead, what is the long-term vision for these missions? And is the ultimate goal to work toward a time where they no longer are needed because the local systems are self-sufficient? Or will there always be a need for further advancements?
I think there will be always need. Our goal is to be the supportive team of creating an environment where free exchange of information, networking, becomes the hub. I truly appreciate the local force because they are advanced, they know what they're doing. What they lack in their academic preparation for the medical side of the equation, it's more didactic versus hands-on training. It's the reverse in the United States. If you look at the preparation of the medical force, it's 2 years didactic, 2 years clinical, hands-on training, see one, teach one, do one, right? So in that aspect of it, we will always prepare ourselves to respond to the need of the Republic in various aspects of it. If it's on the conference side or preparing the nurses in terms of advancement in their nursing assessment and preparing them for them pursuing bachelor's degree and master's degree, and for their betterment, and with them being advanced, they will prepare better. They'll be better prepared to provide higher level of care, which every patient deserves.
Well, I want to thank you for all of the work that you're doing, for joining us here today and having this conversation with us.
The pleasure is all mine. Thank you for the opportunity, and I want to thank the leadership of CivilNet for providing the opportunity for me to share what we have been doing and what we will continue to do in support of our Republic.
Thank you again. And thank you for watching CivilNet.